interview, I made sure that everyone was out of the house. So I've got two lovely little ones. This was not the time where someone would run into the room and be screaming, mommy. We planned a day out. They were out. Everyone was out. Doorbell was turned off. So if you have one of the ones that can be turned off, you turn it off. If you need to put a do not disturb sign for like male people and stuff, put a sign on your door. So you're welcome to the Ace Your Interview workshop with Thriving in the NHS. My name is Ibifunke Kwegba-Otemolu. And the reason that I thought this workshop was helpful is because I transitioned through three specialty jobs, so trust grade roles, and then into training. And I realized that there's a certain pattern to the way the interviews are conducted, and there's a system you can apply if you want to pass the interviews. So I thought I'd share those tips with people who are going for interviews, whether they're going for training or non-training jobs. And during this meeting, you can expect us to talk about how to prepare for the interviews, how to position yourself, whether it's a virtual interview or face-to-face interview. Then we'll talk about how the interviews are conducted for training jobs versus non-training jobs. That's quite similar as well, we'll find as we discuss. We'll talk about how you can stand out during interviews, and we'll talk about some tips and tricks for the interview day itself. On to preparation. There are three tiers of preparation that I think are important. I think people often underestimate the value of preparing with yourself. And what that looks like is timing yourself while you're speaking, recording yourself and watching yourself over again and seeing and listening to the things that you're doing that you'd like to change. So for example, if you're talking, and I remember about a week ago, I was talking to my consultant, she asked me a question and I was, and she's like, put your hands down, go and read the thing and come and present it again. So the way my hands were moving, the impression she got was that I didn't know what I wanted to say and my thoughts were all over the place. So when you watch yourself in a video, you can see those little things that you're doing that you would rather not do, and you can stop yourself. When you work with your peers, you're all working towards the same short-term goal, and you can improve. What you do is when you listen to your peers, you pick up the good stuff that you're doing. When you give them feedback, you help them improve. As they improve, you also improve. So that's the value of working with your peers. And then finally, your seniors. And seniors, this is a tiered approach. So seniors like registrars, seniors like consultants, working with them, getting that opportunity for that feedback that helps you improve yourself. The really critical thing about feedback is that you don't want to receive feedback before your interview and then go to your interview and make the same mistake that you had been corrected about. So you need to see within yourself that you're making those improvements. I found that with myself. When I was doing my preparations, I talked about quality improvement, and I had done a project I was very proud of. That was very good. And talking about it with a senior, a registrar, he was telling me that I didn't understand, I didn't grasp the concept of audits. So clearly I was like, how can he say I don't grasp the concept of audits when I've done this fantastic project? So rather than taking on board that feedback and improving what I was saying, I went to my interview like that. I said that, and one of the interviewers had the same thing to say, that I hadn't demonstrated that I understood fully the concept of audits. So I think it's really important that we take the feedback on board, we improve ourselves before we get to DD. Virtual interviews, what you need to think about is the fact that all the person can see is what's in the screen, right? So the first thing you should think about, even before DD, is your appearance and your attire, or your attire. So appearance, this will start from your hair. If I was going to the interviews, training interviews, I wouldn't have my hair like this. I would have it all pulled back. And the reason is I don't want anybody to be wondering about my hair. Is this, the kind of distractions that can happen? Or why is it spiky? Does it do this? And think, I don't want any distractions. I'll pull it all back. So that's to do with appearance. To do with To do with your what you wear, I would focus on making sure that I am comfortable and that I feel confident in what I'm wearing. So for my interview, I had on one of my favorite, it's a kind of blazer thing that isn't very formal, but is definitely business casual at the least. I had on a top that had these tiny pearl-like things. So I felt really confident and I looked very professional. And I made sure I had worn that outfit. I had set up a Zoom, or I think is it Teams you use for this interview thing. I had practiced with Teams. I had seen what I looked like. The earrings I had on wearing this big, so they were small things that couldn't, nothing to distract the examiner. All I wanted the examiner to do was listen and hear what I was saying and not be distracted by anything else. Background, I made sure that the wall behind me, so the wall I was sitting in front of on a typical day in my house, it had all my son's artwork from school. So I took down all the ones that were very fancy and had very brilliant colors. And I left only the one that had a poppy appeal, something that was very non-distracting. The position of my laptop. So you can see that the top just above my bust is all that's in the frame. You can't see a lot of space above my head. To my left and right, you can't see anything that would distract you. So I had practiced that. At the time, today I'm using a laptop stand, but at the time I didn't have one. I had textbooks and boxes to work with. So I measured the height of those textbooks and boxes where I wanted them to get to. And I had made sure that it was getting the exact view that I wanted. And the view I wanted was where I was looking dead straight into the camera of my laptop. And when I looked into that camera, I knew that I was looking at them, giving them eye contact. And what that did for me.
Looking like this, I think that also affected me.
Yes, so you need to make sure that people are not looking up your nose and they're not looking down. You're looking straight into the camera and you're giving them that eye contact. On the day of my interview, I made sure that everyone was out of the house. So I've got two lovely little ones. This was not the time where someone would run into the room and be screaming, mommy. We planned a day out. They were out. Everyone was out. Doorbell was turned off. So if you have one of the ones that can be turned off, you turn it off. If you need to put a do not disturb sign for like male people and stuff, put a sign on your door. Your lighting is really important, especially if you've got the kind of camera where the lights can be dodgy. So what you want is for the light to come from behind you, behind your camera, so that it's falling on your face. My light is still a bit dodgy because it's quite foggy today, but like on that day, I made sure that the curtains were open wide. All of the light was falling on me, and my laptop was, it wasn't reflecting. You know how there can be that glare on your face. So none of that. So as much as possible, you want to control the environment, control what they see. I would strongly advise against using virtual backgrounds because of the way they blur in and blur out and can also, again, be distracting. Remember that your interviewers are human. They can get distracted. They're doing this over and over and over again for a few days, so it can get very boring. So the last thing you want to do is give them an opportunity for their minds to wander away from what you're saying. So that covers virtual interviews. We'll briefly touch on face-to-face interviews because the goal of today is to make sure that you feel confident whenever you're going to an interview. Again, we'll talk about your appearance and attire. Unlike with the virtual interview where they only see the top half of you, with the face-to-face interviews, your entire self is there. So you need to think about how you're appearing, what parts of your body look like. You need to think about your preparation. So when you think about it, when you go to that interview, you've been given a location. Do you know where it is? Are you just looking for it on the morning of? So if you have to travel, for example, don't travel on the day, go on the day before, go to the hospital, find out where it is, what floor, locate where you're going to be arriving at, okay? When you get to your interview, If there are people offering handshakes or if you're shaking people, make sure you shake everyone's hands. Don't make anyone feel left out. If you have some reservations about handshakes, then explain your reservations and just keep to yourself. So say, for example, it's a gender thing. You're okay to handshake the same gender, but not the opposite gender. You may make someone feel left out. You may trigger people's biases. So just be careful around the way you greet people. I strongly believe I lost out a job opportunity for that reason. I didn't see the person who was offering me her hand quickly enough. And I think she felt shunned by that because the interview went well. The other thing I would talk about is your composure. Think about how you want to comport yourself for duration of the interview. Think about how you want to comport yourself for duration of the interview. Be punctual. Be punctual. That's really, really important to be punctual. Make sure that you are not the person who's rushing in sweaty and then you've lost your composure. Make sure you keep yourself together. Okay, so that concludes the face-to-face aspect of the interview. Now we'll talk about the interviews themselves, because whether you're going for a training job or a non-training job, the key principles for job applications, medical job applications in the UK, they remain the same. The difference you get with the training jobs, unlike the non-training jobs, is that you don't get the time before the question or before your answer to prepare your answer. So with the non-training jobs, you're asked the question on the spot, you deliver an answer. With the training jobs, you're asked the question, you're given time to synthesize your answer, and then you present your answer. And it's usually the same things. So you'll talk about clinical acumen, and I'll explain what I mean by acumen. We'll talk about management. You'll talk about leadership or portfolio or quality improvement, etc. And you'll finally get the opportunity to give questions or comments to your interviewers. So we'll head back now to clinical acumen. The background of clinical acumen is that the person interviewing you wants to know that you are safe to look after the patients that you're going to be responsible for. They want to know that when you see that patient, your mind can understand the trajectory of that patient's care. So is this patient likely going to need another specialty? Is this patient going to be needing to go to theatre? Is this patient going to be needing to go to a high dependency unit? Can your mind see that when you look at that question? They want to know that you know the limit of your capability and you know who your next person is that you call to support you. And in a very short time, you have to synthesize an answer, communicate an answer that demonstrates this understanding. This is not something that you can do on the spot if you have not prepared and practiced. And that is the value of practice, because when you get to your interviews in a non-training job, it's going to be limited because it's the specialty you are applying for. But in a training job, you can be going to a general surgery interview and get asked a vascular question. If you're in a core training application, you can be going, you can be asked anything and you may never have had that experience. So in your practice, what you're meant to spend your time focusing on, rather than getting through as many scenarios as possible, which is also important, but developing a technique. What is my technique for answering these questions? If I've never heard of this thing, if I've never managed this thing, how do I communicate that I can still safely look after this patient? Because the key principles of keeping this patient safe are going to be the same, regardless of the specialty, regardless of what's wrong. Key principles will be the same. How do you practice to make sure that you have refined that skill to be able to deliver that answer in a way that convinces your listener that you can look after the patients in your care? Because that's all they want, is to know that you will be safe and to hear you sound like you are confident because you've done this before for other patients and so you can do it again. So these are the things to think about when you're practicing, so that you make sure you get the most out of your practice. And it's not just about, oh, I haven't done any ENT questions, or I haven't done any other questions, I haven't done enough. It's about, with each session that you get, to be able to convince your listener that you are safe, you know what the issues are, you know how to escalate. What I did in my preparation stations that I found very helpful, because again, when I was practicing, I took on board the feedback and I did something with it. So people, what I realized was, when I would get asked the questions by the person who's supporting me, in my head, I knew exactly what I wanted to do. But by the time I was speaking, it was all over the place and it wasn't clear that I knew what I wanted to do. So for the purpose of my practice, what I then started to do was I would write it down. So I would go from, this is what is wrong with the patient. This is the most likely thing wrong with the patient. This is what I would like to do for the patient. And this is how I would do it, until I got to the end. What would be the management? What would be the escalation, etc. And for this, as you're using the interview books, there will be acronyms. So spikes, STAR, this, that, whichever one you're using, just pick one and stick with it. Don't try to jump between different recommendations. Just choose the one that works for you. And make sure that you get, so once I wrote it down and I got to the end, I would then be more confident as I spoke about it with the person that was listening to me. And I found that this really made me better. And when I practiced with myself as well, I could see that once I wrote it down. So in my 5 minutes on exam day, I had my A4 sheets and I wrote down my things. And what happened was, in the clinical scenario station, I had left out something very important, but I had noted it when I was writing down. So as soon as I was prompted, I gave them the answer. Now, one of the examiners was very critical and said, oh, I had to be prompted. But the other two noticed that as soon as I was prompted, I knew exactly what they were talking about. So I wasn't penalized for that by those two examiners. So that's the sort of thing that you want to spend this preparation time preparing. It's, what's my technique? What's my approach? How do I make sure that I don't spend time unnecessarily talking about things? So for example, every single person that's going to the interviews will talk about ALS or ATLS or CRISP or whatever is relevant to your specialty, the protocols for initial assessment of the patient. So what you don't want to do is spend over 1 minute talking about those things. Within 30 seconds, you should have said that this is the protocol you will use to approach and assess this patient. And once you have assessed the patient, you have sent off bloods, you've done this, then you need to get to the management of the problem that the patient has come in with. And then you show your understanding of the investigations that are required, the input that is required, the specialties and things like that. So for your training interviews, when you practice, it's really important to know the time. What time slot are you giving for each of these stations, so that you can work within that time and you can fit your answers in neatly and make sure that you're on point, you're maximizing the time, you're getting to the end of your station. So you want to be finishing your station with your interviewers where you get to the end and you're waiting for the bell to go off. Not that you're being interrupted or being prompted all the time until the bell goes off. So think about these things as you're practicing, so that you can really, really optimize your practice. The next thing that they'll ask you about is management. Depending on whether it's core training or ST level, your management of the patient. This question does not focus on clinical management. It focuses on how you understand challenges and how they can influence what happens to the patients. But in this question, they'll ask it to you in a way where, if you don't pay attention, you focus only on patient safety. But they also want to see that you have compassion for your colleague, or you have insights into what's happening to your colleague that is driving a behavior or things like that. So when you're practicing, bear that in mind, that you always have to have patient safety, but also the interests and the best outcome for your colleague at hand. So popular questions like, what do you do if your colleague comes to work drunk? And then you focus on, the person is drunk, cannot see patients whilst drunk, and things like that. But how about your colleague? Are they becoming alcoholic? Is this a problem? What's driving that behavior? Are they struggling to cope? You have to balance things. So again, when you use the interview preparation websites and books, they'll give you acronyms, they'll give you approaches, they'll tell you things that you can do. Pick one, stick with it, hone it, and be able to apply it. But always think, whatever scenario that you're given, the goal is not only to think about patient safety, but to also think about your team and looking after the well-being of your team as well. And if you answer in that way, you'll be most likely to get the maximum points for that station. The next interview section, whether training or non-training, you'll talk about your portfolio. And